three-parent baby. This gene therapy, called mitochondrial donation treatment, prevents children from inheriting incurable diseases caused by faulty mitochondria in the mother's DNA. Mitochondria is the powerhouse of the cell, providing energy to critical organs like the brain, heart, and muscles. Unlike other DNA, mitochondrial DNA comes only from the mother and carries 37 genes. If these genes are mutated, children can develop severe conditions such as muscle weakness, seizures, blindness, or early death. These disorders usually appear in infancy or early childhood, and about 1 in 5,000 babies is affected. Doctors in the UK recently used this therapy to help 7 women at high risk of passing on mitochondrial disease. 8 babies, including a set of identical twins, were born healthy after IVF procedures using DNA from 3 people. The process involves fertilizing the mother's egg with the father's sperm, removing the nucleus, and inserting it into a donor egg with healthy mitochondria and no nucleus. This creates a baby with the parent's DNA and healthy mitochondria from the donor, breaking the chain of inherited disease.
CAR T-cell therapy. This therapy modifies a patient's own T cells, white blood cells that normally fight infections, so they can hunt down and destroy cancer cells with deadly precision. In cancers like acute lymphoblastic leukemia, immature white blood cells called lymphoblasts build up uncontrollably in the bloodstream due to genetic mutations in bone marrow cells. The disease progresses quickly and can be fatal, especially in adults. Standard treatments like chemotherapy often fail in advanced cases. CAR T therapy offers a last resort option by turning the patient's immune system into a custom cancer-killing machine. Doctors start by collecting T cells from the patient's blood. In a lab, these cells are genetically engineered to produce a new receptor that specifically targets proteins on the surface of cancer cells. Once modified, the T cells are infused back into the patient. These engineered cells then multiply inside the body and seek out cancer cells, sometimes destroying hundreds of thousands per T cell.
Lentiviral gene therapy. This therapy modifies a child's own stem cells to restore a missing enzyme and prevent the progression of metachromatic leukodystrophy, MLD, a rare but fatal brain disease. MLD is caused by mutations in the ARSA gene, which lead to a deficiency or complete absence of the ARSA enzyme. Without this enzyme, toxic substances called sulfatides build up in the brain and nervous system. The result is progressive damage to the white matter that insulates nerve cells. In early onset cases, symptoms can begin as early as toddlerhood and include loss of muscle control, cognitive decline, and early death, often within a few years of symptom onset. Libmelli is a one-time treatment approved in Europe for children with early onset MLD, who are either pre-symptomatic or in very early stages. Doctors collect the child's blood stem cells, use a lentivirus to insert functional copies of the ARSA gene, and reinfuse the corrected cells. These cells engraft in the bone marrow and begin producing the missing enzyme. Libmelli costs $4.25 million per patient. It is currently one of the most expensive gene therapies in the world.
CRISPR gene editing. This therapy edits a patient's blood stem cells using CRISPR-Cas9 to stop sickle cell disease and beta thalassemia, 2 heritable conditions that previously required lifelong care. Sickle cell disease causes red blood cells to form rigid, crescent shapes that block blood flow, leading to extreme pain, organ damage, and early death. Beta thalassemia disrupts the body's ability to make hemoglobin, resulting in severe anemia. Both are caused by mutations in a single gene, making them ideal targets for gene editing. Traditional treatments involve repeated transfusions or bone marrow transplants, which are often risky or unavailable. CRISPR works like molecular scissors. Scientists program the Cas9 enzyme and guide RNA to locate and cut the defective DNA sequence in the patient's own stem cells. These cells are edited in a lab and then returned to the patient's body. Once inside the bone marrow, the corrected cells begin producing healthy red blood cells with fetal hemoglobin, which prevents sickling and restores oxygen delivery. The FDA-approved treatment, Casgevy, costs around $2.2 million. Despite the high price, it offers the potential for a lifelong cure after a single procedure. RNA Splicing Therapy. This therapy boosts production of a critical protein by correcting faulty RNA splicing, helping infants with spinal muscular atrophy SMA, survive and gain motor function. SMA is a genetic disorder that causes the death of motor neurons, nerve cells that control muscles used for movement, breathing, and swallowing. It is most commonly diagnosed in babies and toddlers. The disease occurs when mutations disrupt a gene called SMN1, which normally produces a protein needed to keep motor neurons alive. Without this protein, children rapidly lose the ability to move, and in the most severe cases, most infants die before their first birthday. The treatment, called Spinraza, is based on a technique called antisense therapy. It uses small synthetic RNA strands to modify how a similar gene, SMN2, is spliced. Normally, SMN2 makes very little functional protein. Spinraza changes how the RNA is edited so the gene produces much more of the protein, effectively replacing what SMN1 cannot provide. Spinraza costs $750,000 in the first year and $375,000 each year after, requiring repeat spinal injections. Despite the cost, it has extended and improved life for thousands of children with SMA. Virus gene therapy. This therapy uses a modified virus to deliver a working copy of the RPE65 gene into the retina, helping children born with rare genetic blindness regain their sight. Leber congenital amaurosis is one of the most severe inherited eye disorders. It affects how the retina detects light, causing symptoms like poor visual tracking, unresponsive pupils, and involuntary eye movements from infancy. Without treatment, most patients become completely blind by middle age. The condition is caused by mutations in any of over 24 genes, but one key culprit, RPE65, can now be directly targeted with gene therapy. Doctors inject a harmless adeno-associated virus, or AAV, under the retina. This virus carries a healthy copy of the RPE65 gene and inserts it into the retinal cells. In 2017, this treatment, Luxturna, became the first gene therapy approved by the FDA. It works by restoring the retina's ability to convert light into electrical signals, enabling patients to see again. In trials, even children who had never seen stars before could suddenly spot them.
RNA drug treatment. This treatment uses RNA interference, RNAi, to lower oxalate levels in the blood and urine, preventing kidney stones and damage caused by primary hyperoxaluria type 1, PH1. PH1 is a rare genetic disorder where the body produces excessive oxalate, a waste product normally removed by the kidneys through urine. When too much oxalate builds up, it forms crystals that cause painful kidney stones and, eventually, damage the kidneys. As kidney function worsens, oxalate can accumulate in the bloodstream and deposit in other organs, causing irreversible harm. Lumasiran is an FDA-approved medication for PH1 that uses RNAi technology. It works by silencing the gene responsible for producing the enzyme that creates oxalate, reducing oxalate production at the source. This helps lower oxalate levels in both children and adults, protecting kidney function and reducing stone formation. Personalized CRISPR therapy. This gene therapy used a custom-designed CRISPR tool to treat a baby with CPS1 deficiency, a rare, deadly metabolic disease, marking the first case of individualized gene editing for a single child. CPS1 deficiency is a type of urea cycle disorder that prevents the body from converting ammonia into urea. Ammonia is a natural waste product formed when proteins are broken down. In healthy people, the liver turns ammonia into urea, which is safely eliminated in urine. In babies with CPS1 deficiency, the missing enzyme causes toxic ammonia buildup, which can trigger seizures, brain swelling, coma, and death, often within the first year of life. The standard options for treatment are usually dietary changes and then liver transplant, but infants must first be stable and strong enough to survive the surgery. In 2025, doctors at Children's Hospital of Philadelphia developed a one-time personalized CRISPR therapy for a 6-month-old boy named KJ. They used base editing, a precision gene editing method, to fix his specific CPS1 mutation. The treatment was delivered via lipid nanoparticles directly to his liver. After 3 infusions, KJ has shown no serious side effects and is now able to eat more protein and fight off infections without dangerous ammonia spikes. Gene replacement therapy. This treatment uses a harmless virus to deliver a healthy copy of the OTOF gene directly into the inner ear, repairing the cause of congenital deafness known as DFNB9. DFNB9 is a hereditary condition caused by mutations in the OTOF gene. This gene produces otoferlin, a protein critical for converting sound signals into electrical impulses that the brain can understand. Without functional otoferlin, patients cannot properly detect or process sounds. Traditional devices like hearing aids and cochlear implants often fail to fully restore hearing in these cases. In a recent clinical trial, researchers injected an AAV carrying the healthy OTOF gene into the inner ears of 10 patients aged between 1 and 24. Hearing thresholds improved on average from 106 decibels, indicating profound deafness, to 52 decibels, which is considered mild hearing loss. The best improvements occurred in younger patients. No serious side effects were reported. This breakthrough shows promise for treating genetic deafness by fixing the root cause rather than compensating for hearing loss.